Melanoma is on the rise among Hispanics in Florida, according to the Miami Miller School of Medicine. On top of that, Hispanics are more likely to be diagnosed later, making them more likely to die from the disease. Miami-based dermatologist Dr. Flor Mayoral says just because a person has darker skin does not mean he or she should worry any less about sun damage.
If they're not symmetric, if they don't look the same on both sides of the lesion, if the borders are irregular, or if the color within the lesion is multiple, if there's shades of brown, shades of tan, black, sometimes reddish, that is a sign that it could be a melanoma.
Doctors who led the research say the reason for the increased numbers of melanoma in Hispanics might be due to the great amount of light-skinned Cubans in the state. Florida is also in a location where there is a heavy ultraviolet exposure, so the findings will not relate to most of the country. More than $70 billion is the amount the country loses each year due to obesity. The hidden cost comes from the fact that overweight people tend to be less productive than their healthy-sized counterparts. The study by the Journal of Occupational and Environmental Medicine looked at medical expenses, sick days, and health-related productivity costs. Author of the study, Eric Finkelstein, says now that the hidden costs have been uncovered, employers should see what sort of intervention they want to implement. The costs increase with the person's body mass index. Less obese men cost more than $1,000 a year, while larger men cost about $6,000 a year. In comparison, employees who smoke and ones with mental health issues cost the country more than $600 billion combined. Nick Coppert, KCSN News.